Good morning, everyone. My name is Dr. Rusil Vasa. My study topic was to study risk factor in the children aged 2 months to 5 years with the acute lower respiratory tract infection admitted at tertiary care hospital. The aim was to observe the demographic profile, feeding practices, and immunization status in children aged 2 months to 5 years admitted with the acute lower respiratory tract infection. Total 153 patients were enrolled. Uh, to observe age distribution in the patients where age suggested occurrence of lower respiratory tract infection is higher in infant age group with the 40.5 percentage. Sex distribution, male gender was slightly more diagnosed with ARDI due to the gender bias as probably attributed early seeking of medical advice in case of male child. Pneumonia, in my study, pneumonia was the most common diagnosis with the 54.2% cases, followed by bronchiolitis, followed 28.8 percentage, and Walry with the 17 percentage. Socioeconomic status was found statistically significant association. ALRTI is more common in lower socioeconomical class with 59 percentage cases of pneumonia, 25 cases of bronchiolitis, and 15.8% cases were Walry. Overcrowding was a significant risk factor for respiratory infection with 54.24 percentage. In my study, exclusive breastfeeding were receiving 57.5%. Importance of exclusive breastfeeding is well known to decrease in the causation and severity of respiratory infections. Bottle feeding was observed in 38% children in our study sample. Bottle feeding leads to various infection and is important cause of faulty feeding in children. In bottle feeding, there is reported more children with pneumonia than Walry and bronchiolitis. We found significant immunization coverage of children due to better awareness of healthcare workers and mass media sources, with 61 percentage with complete immunized child. Strategic initiatives such as intensified awareness campaigns, outreach programs, and innovative vaccination delivery methods have played a pivot role in expanding immunization coverage across the nation. So the conclusion was that in the present study found that young age, lower socioeconomical status, overcrowding, bottle feeding, lack of exclusive breastfeeding, incomplete immunization were the risk factor for ALRTI. Proper health education, counseling to parents, proper nutrition, promotion of exclusive breastfeeding, and complete immunization will help to reduce the under 5 mortality.
Did you find any correlation with immunization status and severity of LRTI?
Mainly due to proper immunization, and there is a mortality rate was less.
No. What I am asking is 4.6% of your population was unimmunized, right?
Yeah.
So what was the prevalence of severity of LRTI in those children?
The radiological sign of pneumonia. One clinical, the clinical sign and the radiological sign of pneumonia. One, if I need to define. One clinical sign, one radiological sign, this is Paku pneumonia. I've got a patch, opacity, homogeneous opacity. Within the patch, what do I look for? That it is a pneumonia and it is not an effusion.